Hello again. Last time we looked at the difference between NHS continuing healthcare and local authority funded care, and we discussed how the way you describe your care needs influences whether they are considered health or social in nature. Now we will look at the assessment process that you will go through to decide whether you qualify for NHS continuing healthcare. The assessment process has two stages. Firstly, there's a checklist to see if you have health needs. If you pass the checklist stage, you will go forward for a full assessment of all your care needs. Following this, a recommendation is made to your CCG as to whether you have a primary health need and are therefore entitled for NHS funding. From the completion of the checklist to receiving the decision of the CCG should take no more than 28 days. Both stages of the assessment process will look at your care needs across several broad areas known as care domains. These are behaviour, cognition, psychological and emotional, communication, mobility, nutrition, continence, skin, including tissue viability, breathing, drug therapies and medication, altered states of consciousness, and finally, other significant care needs. These care domains were not designed specifically for people with spinal cord injury and are used to assess anyone who needs care. So, not all the domains will be directly relevant. The checklist stage is a low-level filtering process that can be carried out by any health or social care professional, such as a GP, district nurse or social worker. It looks at your needs in each of the care domains and scores them into one of three levels. A means you definitely have healthcare needs in this domain. B, you may have healthcare needs, but it is not absolutely clear. And C, you don't have healthcare needs in this domain. Whether you go on to a full assessment will depend on how many A's, B's and C's you score. You need to get as many A's as you can. At the checklist stage, the other significant care needs domain is not scored, so you need to make sure any care needs that may fall into this category are included elsewhere. The full assessment determines whether you are recommended for NHS continuing healthcare funding. It must be carried out by an appropriately qualified multidisciplinary team, or MDT, using the Decision Support Tool, or DST. The multidisciplinary team is usually led by a continuing healthcare coordinator, often called a nurse assessor, and consists of 2 or more qualified professionals. They should seek evidence of your health and social care needs from you and people involved in your care, and they should accept the evidence you and others provide, for example, SIA fact sheets or your 48-hour care diary. It is important to remember that the people assessing you may not be experts in spinal cord injury. The DST uses the same care domains that were used in the checklist stage, but this time the 12th other significant care needs domain is included. The assessment is more rigorous than the checklist, and your care needs will be explored in much more detail. The scoring of your level of care need is also more comprehensive. There are 6 categories that your care needs can fall into: priority needs, severe needs, high needs, moderate needs, low needs, no needs. However, you will see that the top 2 categories are not available in all the care domains. When you are telling the assessors about your care needs, it is not enough to simply mention them. You must gather evidence that proves their existence and illustrates how it affects your health. In other words, the scores need to be evidence-based. This isn't always easy. For example, we are very susceptible to pressure sores, but with the right care in place, it is possible to avoid them. If you are clear of pressure sores at the time of your assessment, it is difficult to provide evidence of the care you need to avoid developing one. However, where needs are well managed and your existing care is working effectively, the assessors are instructed that the need should be recorded as if that care and treatment were not being provided. The way they sum that up is by saying a well-managed need is still a need. Whether you qualify for CHC is not simply determined by the scores across the care domains. The MDT also needs to consider your overall care needs in their totality and use professional judgment to decide whether the level of your healthcare needs exceed the lawful limit of local authority care provision that we discussed before. They must determine whether you have a primary health need. This is achieved by considering the nature, complexity, intensity, and unpredictability of your care needs. These are 4 very important words. Nature describes the characteristics of your physical, mental health, or psychological needs and the overall effect they have on you. Complexity is about the level of skill and knowledge required to manage your range of needs. Intensity relates to both the extent and severity of the needs, plus the support required to meet them, including the need for sustained, ongoing care, sometimes called your continuity of care. The term unpredictability describes how your needs fluctuate and are challenging to manage. It also relates to the level of risk if adequate and timely care is not provided. So, the more intense, complex, or unpredictable your needs are, the higher the scores will be in each domain, and the more likely you are to be found to have a primary health need. While you can only score each of your care needs in one of the care domains, you can refer to needs across different domains to illustrate the complexity and unpredictability of your overall care need. For example, explain how your continence care needs can impact on your skin care needs if you were to have a bladder or bowel accident. How the assessors score your needs will play a large part in determining the outcome of your case, so you need to prepare yourself to make sure that all your care needs are included in the DST. Think ahead about how you will describe them. So, before your assessment, take time to familiarise yourself with the decision support tool. This probably sounds terribly complicated, and that's because it is complicated. However, there is help available. The SIA can provide you with help and resources to prepare for your assessment. So, before your assessment, you might want to contact the SIA advocacy team, who will be able to help. Thanks for listening and good luck with your assessment.